We are now moving on to part 3. As I have previously alluded to, the genome of hepatitis C virus is quite simple and ends up encoding a single polypeptide just over 3,000 amino acids in length, which is subsequently cleaved by the host peptidase in the structural region, and this leads to the production of the two envelope proteins and the nucleocapsid protein or the core protein, whereas the non-structural regions are cleaved by hepatitis C viral encoded proteases into 6 non-structural proteins, which includes among them a protease, a cofactor for this enzyme, a helicase, and an RNA polymerase that, as we recently discussed, is highly error-prone. I have now added in some of the unpronounceable drug names for the antivirals that have been developed, for most of the antivirals that have been developed to target hepatitis C specifically. Some of the first ones were targeted at NS3 and NS4A, which, as I mentioned, encode the protease and the protease cofactor, whereas some of the other main category has been antivirals that inhibit RNA polymerase, and these drugs may be nucleoside analogs or non-nucleoside analogs. More recently, there is a group of antivirals that specifically target the NS5A product, which, as it turns out, is apparently important in the replication process and possibly the immune response. Which brings me to an important concept, which is that of the importance of viral host interactions in producing some of the pathology in hepatitis C and also potentially explaining the clearance. Thinking about this in the framework shown here, a virus will elicit an immune response, which in this case is T-cell predominant. If effective and robust, it will lead to viral clearance. However, if it fails, viral persistence will result. In particular, if the immune response leads to, in this case, the presence of lymphocytes in the hepatocytes, which has been described, then cytokines will be produced, which will lead to a vicious cycle of further inflammation, and this can occur over time and eventually lead to fibrosis.